Hello, my name is Athulya Pathirana. I'm a patient from Sri Lanka, international patient to India. I came here to do my ICD Explantation procedure because I have been misdiagnosed and I have been implanted with a ICD device. So I came here to explant my device and get more treatments for my epilepsy treatment. So I consulted Dr Soumen Devidutta, a cardiac electrophysiologist. He helped me from the beginning with my situation, explained me everything, and he helped to plan my trip. He helped to find me an accommodation and with all the details. And while arranging the tour, Mr. Lokeshwar from International Patient Department and Miss Jessica, they both helped me a lot to arrange my medical visa and arrange a video meeting with my Dr. Soumen Devidutta. And since there, doctor gave me his number and he helped me and guided me with everything. He explained me my condition and explained me everything what happens during the surgery and what kind of things I have to face, all the complications which can arise. And he was so approachable since beginning. I think he's the most approachable doctor I have met because he has been so helpful and explaining everything. So I didn't need to think twice because I could imagine, I can get an idea like he's really legit and trustworthy and he knows what he's doing. And so I could arrange my visa quickly and I came to the procedure and everything went well. Apollo Hospitals Hyderabad was really helpful with everything, the staff, the nurses, doctors, sisters, everyone, and even the minor staff, they were all helpful and guided me with everything and provided all the details I needed. And they were checking whether I'm okay all the time. I can highly recommend this place like for Apollo Hospitals to any international patient because I know a lot of people are wondering and looking for international treatments, especially expats, those who are coming from Europe, from other Asian countries. They are looking for medical treatments abroad and I can highly recommend Apollo Hospitals because they are so affordable from my experience. And I'm really happy I could do my procedure successfully and without any complications, and it was all as explained, nothing was different, all were as planned, all went through very well, and everything Dr. Soumen Devidutta planned really well and explained me, and all went as planned, so I don't have anything to worry. So I'm really happy and I'm asking again, if anyone has any doubt, just don't think twice to get services from Apollo Hospitals India because they have the most innovative techniques and everything. That's my experience. Thank you very much all, and again thank you Dr. Soumen Devidutta and Apollo Hospitals Hyderabad. Thank you very much for everything.
Hello viewers, greetings. I'm Dr. Soumen. I'm the cardiac electrophysiologist here in Apollo Hospitals, Hyderabad. I'm pleased to bring you another success story, this time of a young boy from Sri Lanka. His name is Atulya. He's a bright IT professional. At the middle of the second decade, he started having these seizure attacks, these fits or convulsions episodes, and was clinically diagnosed with a cardiac arrhythmia somewhere in Sri Lanka and was implanted consequently with a device called ICD. Now ICD is a electrical device just like a pacemaker which is implanted here or here in the body, which tends to treat the cardiac arrhythmias which can be fatal. As it turned out, after implanting the ICD as well, he continued to have those convulsions or fits, and when the ICD was interrogated, there did not seem to be any cardiac arrhythmia for which he was implanted the device in first place. So his diagnosis was revisited and we were probably dealing with not a cardiac arrhythmia but probably a neurological disease called epilepsy, in which patients can have episodes of fits or convulsions. So now this guy, Atulya, was a young man who was in late 20s and was willing to move on in his life due to get married, and he wished to get the device explanted from his body, which is a fair call. He wanted to get it explanted. We must understand that the devices have two components. One is the device itself, which is in the pocket here, removing which is quite easy. But the second element, which is threaded through the veins into the heart, which is called the lead, is very challenging, and we need a specific procedure called lead extraction for that. Now, he sought our consultation through an online channel, and then eventually came over here, Hyderabad, to get the device explanted. He got the procedure done electively under general anesthesia. I'm glad it really went on quite smoothly as expected, and the device along with the lead could be removed in toto. That said, lead extraction is not among the simplest of procedures. We often are a little anxious before the procedure. There's a lot of planning which goes into doing these procedures, sometimes imaging techniques, especially for very old leads and ICD leads, although in his case the lead was about 3 years old. So it was not probably as challenging, but still sometimes you can have surprises. Often we do such procedures with a cardiothoracic backup, with our surgeons ready to open the chest just in case there is a perforation or complication while removing the lead. Again, for extractions we have dedicated tools, quite sophisticated mechanical extracting tools, which were used in him, and it was used successfully. And after explanting the device, the pocket was closed, and he left India, left very happy and content with his objective achieved. Not only that, we also put him across with our neurologist who also evaluated his epilepsy. Epilepsy medicines were updated, and he's right now under the right group of medicines, and he's doing rather well. And I hope him all the best and all the happiness and success as he embarks on his future life, including marriage, as he leaves us. Thank you so much.